Racist white conservatives continue their attack on DEI. Y'all know CRT, affirmative action. We can go on and on and on. That's what they're all about. Now, led by Elon Musk and others, they're saying, oh, DEI is going to lead to folks dying because we have all of these unqualified black and other minorities in the healthcare space. These are the same people whining about black pilots, saying, oh, there are going to be crashes all around. As if we haven't seen airline accidents with white pilots. As if we haven't seen medical deaths from white doctors. But y'all see what the thing is. What they always do is try to attack people of color. This is really an anti-black effort. So you've got North Carolina Representative, Congressman Greg Murphy, who's introduced the EDUCATE Act, embracing anti-discrimination, unbiased curricula, and advancing truth in education. That's what he's calling the bill. It will prevent medical schools that provide DEI programs from receiving federal funds. Murphy says DEI could end up costing people's lives. Listen to this fool.
Medical schools are then charged with educating and training their doctors to be the most competent and excellent in their fields. In the past, students were admitted based upon merit, excellence, and aptitude. Sadly enough, those days are changing. DEI, the so-called diversity, equity, inclusion theology, is sowing mistrust in the field where trust is so reliant. And so when it comes down to patient care, DEI can even lead to harmful, if not deadly, consequences. Guys, this is medical school. It is not art school. It is not English school. It is medical school. As Dr. Ben Carson, whom you all know, the black neurosurgeon, said about medical school, putting aside merit instead of emphasizing qualities like race, sex, religion, and all others. By putting aside merit, we hear only that can endlessly cost people their lives.
What you just heard there is complete and utter bullshit. But that's what they do. You see what they do when they say, oh, no one's discussing merit. That's a lie. He's lying. He's a doctor and he's lying. Dr. Yolanda Lawson is president of the National Medical Association, the nation's oldest and largest organization representing black physicians and health professionals. She joins us right now. I'm glad to have you here. So, I mean, listen, since we got here, and it wasn't my choice, every time something happens, it's like, no. They're not qualified. They're not qualified. Take your pick. Automotive industry, healthcare, legal, I mean, you can name it. White racists, that's their go-to. Oh, if they are allowed in, all hell is gonna break loose.
It's devastating, to say the least. We at the National Medical Association, I've had calls from doctors all over the country who are outraged by this. We know that 5.7 of doctors in this country are black. And then you look at health disparities in this country. Black people are more to die of almost every disease state I can think of. We're disproportionately affected in it. And so, first of all, I'd like to say around merit, you can't get through medical school if you cannot comprehend, and the curriculum is so demanding. It's disheartening to hear this, and it's definitely disheartening to hear this from a medical professional who I know understands what we are up against in this country.
You have the Association of American Medical Colleges. They've responded to this nonsense. Go to my iPad. They say the AAMC firmly reiterates its commitment to addressing and mitigating the factors that impair effective physician-patient relationships when preparing the future physician workforce. The presence of diversity, equity, and inclusion in medical school curricula is intended to train the next generation of physicians to respond most appropriately to the rapidly diversifying populations that they will serve. Doing so increases the likelihood for better health care and healthy lives for all patients including individuals who have been historically marginalized by the healthcare system. So they basically are saying, Congressman Murphy, you can go to hell.
Well, they didn't say it exactly like you said it, but all of us in the industry, we're all working together to come out and speak out against this because, like I said, it's really devastating. And unfortunately, we are unable to rely on folks always doing the right thing, right? And so these DEI structures and these frameworks were put in place for a reason. And if you think about it, government mandated reasons, right? To ensure fairness, equity, and justice. And so, again, when you talk about reversing these frameworks, it's not only Black race is going to be impacted. You have to think about ageism, sexuality, right? Will come to play, gender issues. So there's a broader conversation here. And I don't think anyone can be a bystander around this. I think we all...
Well, Representative Murphy, you don't see him talking about racism in the healthcare industry. You don't hear him talking about, oh, why is it that when Black patients get treated by Black doctors, their outcomes are different than white patients? Oh, it's amazing how they gloss over all of that, but then want to lock in on DEI. Absolutely.
You heard him talk nothing about disparities. You look at maternal mortality. Black women are 3 times more likely to die in childbirth. You look at infant mortality. Our babies are twice as likely to die than a white baby. You look at diabetes, heart disease, cancer. Black men, twice as likely to die from prostate cancer than a white person. And so he's not addressing it. It's narrow and it's unfortunate.
Questions, Derek?
You know, one of the things that's really appalling, just listening to a medical doctor to attack others who are in that profession. And as you stated, you know, 5.7% Black doctors in the United States, 2.1% dentists, and 1.5% lawyers. So when you think about the contributions that Blacks have done for a long time, I mean, we just had Black History Month, Roland, just last month. I mean, when you think about the Black doctors who had cutting edge around blood transfusion, my question is, how do we combat this? Because this kind of information is really disheartening for those who are in Meharry, right now, both on the medical and dental side, those in the Morehouse School of Medicine, they're hearing this kind of language. And so how do we need to change this narrative while they're, you know, stressing over getting through some predominantly Black schools? Meanwhile, they hear someone that's a doctor that's in a profession that they're looking to go in towards.
I'm going to comment to what you just said, because over this last year, we have witnessed multiple crusades around and attacks around DEI. Probably the most unfortunate to me are around scholarships, right? Yeah. So we can no longer provide scholarships for Black students, right? And so when you think about last year as Howard and other HBCU medical schools started getting letters, right? They're included in this, that they can't, but you have to go back, as Roland just mentioned. You have to go back. There's historical evidence, and there were historical occurrences. These structures, we had to open our own medical schools because they wouldn't let us into theirs. And so it's very unfortunate that this is happening again. And so what's being done, we are all coming together. And so I started reaching out. And so in April, we're having a convening of all the Black healthcare entities and organizations. The National Bar Association is involved. The National Business League is involved. We are doing a convening, really, and this stemmed after last year's SCOTUS decision, because my concern was the workforce. What downstream implications will this have on the workforce? And now this is even worse, what just happened.
Julian?
First of all, Doc, thank you so much for your work and for basically helping to combat this ignorance, because that's what it is. It's ignorance. And they don't even know what DEI is. So we need to insist, they say diversity, equity, and inclusion. Who is against inclusion? And I'm glad that you raised the stats that you raised about the health disparities, because they very much do exist. You didn't notice that man talking about the Tuskegee experiments, or there are a whole half a dozen things. Black female mortality. What happened to Serena Williams? You didn't hear him deal with any of that. But I'm wondering, in terms of the National Med, and 2 or 3 of your former presidents are good friends, but I'm wondering if there's a legislative strategy that you're working on. We know that right now, I hate to be paranoid, but they are out to get us by whatever means necessary. Anti-affirmative action, voter suppression. This man didn't have to do this. He basically, this is all ideological. It's not based in reason or fact. It's based in ideology. But the National Meds at one point did have, and I haven't kept up, but did have some folks who were working on legislation. And I look forward to your summit. Please invite me. I look forward to your summit, because getting everybody under the same roof is going to be really important. But what about legislation? Are there ways that you have identified that we could fight back legislatively, not just nationally, but state by state? Because we know that southern states that have a preponderance of Black people are going to be the ones that are going to ride on this man's coattails if they can.
You're absolutely right. And, you know, I'm based in Texas. And you know what just happened here, the dissolution of DEI offices in Texas. We knew Florida, and then today we know Alabama came on board. So our approach to this will be at a national and federal level, and then through our state societies and locals. You're right. You're absolutely right. We have to advocate at the state level, but we have got this. If there is no time in history, people have got to vote. When you look at Texas, and there are more Black people that live in Texas than any other state, right? We have got to vote for the interest broadly, because of course our interests are not being taken into account. And so this advocacy work is going to be ongoing. We're doing some other things and some strategies in April, again, bringing everyone together to determine how, while we are mutually aligned, how do we advance policies and prevent some policy or legislation such as this from passing?
Congo.
Dr. Lawson, thank you so much for your work and your leadership. The question I have, and I don't know if it's too early to see this, but are you starting to see an effect from hospitals and other medical facilities as it relates to the hiring practices? Are they starting to slow down in hiring Black doctors, or, taking, Black med students into their residencies and the like? Is it too early to tell, or are we starting to see trepidation from the people that do the hiring?
So the hiring piece is one piece, but again, you only have a set pool. When you look at Black men, it's been 80 years and we haven't increased the number of Black men in medicine. You look at the numbers for medical school admission for Blacks as a whole, fairly stagnant, right? So for us to get over that 5%, because you understand what the goal here. The goal is racially concordant care. Are there enough Black doctors in this country to take care of the Black population? And it's not. Right? So you could seek out a Black doctor, you just may not be able to always get one. And so we know that there's distribution issues. There are all these issues that we want to address. But when you look at the hiring piece, your pool of applicants is not that great. And then you're right, there are institutions that may not be very inclusive environments for Black doctors to work in. I'll say it like that. We even look at residency programs. I'll look at me. I mean, so I think about these situations that we are put in, but these practices and these policies that are being proposed are not going to be positive or beneficial for this country. We know that last year, JAMA, there was a study, having one Black doctor in the county improved the lifespan, not only of the Black people, but everybody. Even the white the white community. So you have to think about the value of the Black doctor, and that's what I advocate, is the value of the Black physician.
Well, absolutely. When is this gathering going to take place in April?
It's April 11th. We will have a press conference on the Hill on April 11th. April 13th is the convening. That is when all of the African American healthcare organizations and others will convene in Washington, D.C., working on formalizing, right, this policy structure, because the legislative piece of this, we understand, is going to be important, right? Prior to this, I was on with our policymakers, right, working on what that looks like. And I'm also reaching out to other minoritized organizations. You heard me state, this is going to be more than about race. There are other implications that could be impacted if this legislation was to pass. And Roland, you're actually on the schedule to be there on April 13th. I hope you have not forgotten.
No, I got it. I'll be there. That's Saturday. I'm there. I got you. All right. I appreciate it.